4 out of 5 people experience lower back discomfort at some point in their lives, which is a frustrating issue. It is the most frequent cause of visits to doctors and other healthcare professionals. Disability secondary to LBP has grown by 54% over the past 3 decades. More than 10% of the population has chronic low back pain, which is the 6th most expensive ailment in the US, costing more than $90 billion annually, according to a paper published in JAMA Internal Medicine in February 2022. It now poses a public health risk. The lower back is a complicated arrangement of numerous interrelated anatomical systems. The bottom 5 lumbar vertebral bodies of the spinal column support a large portion of the upper torso's weight. Rubber-like discs that serve as cushions are present between them. Joints, ligaments, and tendons that connect the back muscles to the bony column hold the vertebrae together. The spinal cord and vertebrae run parallel to each other, extending pairs of nerves to various body areas. These nerves carry messages from the brain that regulate movement and other bodily functions. LBP comes in 2 different forms. Acute or short-term conditions can linger for a few days or several weeks. Common painkillers and physical therapy typically work to treat transient episodes of pain. In other cases, the discomfort and associated handicap may not go away for several months. Up to 20% of people who experience an acute incident do not have quick relief from their symptoms. The illness is deemed chronic if the clinical issue persists for 3 months or more, despite treatment. LBP can appear suddenly or gradually, and the lower back and buttocks may experience a sharp or mild aching. Sciatica is the medical term for it when it extends into the lower extremities. Depending on how their body is positioned, some people may experience an increase or decrease in their discomfort. Others struggle with daily activities and experience accompanying stiffness, difficulty standing up straight, poor balance, muscle spasms, and sleep issues. Although LBP can affect anyone, there are risk factors that raise the likelihood of it happening. These consist of age. The disease strikes for the first time often between the ages of 30 and 50. As people age, it strikes more frequently. Weight. Carrying too many pounds puts more strain on the lumbar spine, which commonly results in complaints. Work and lifestyle. Having a job or doing activities that require a lot of lifting or twisting can result in damage and cause LBP. General health. LBP is more common in those who smoke, drink excessively, are sedentary, have a family history of certain malignancies, and have arthritis. Psychological, stress, depression, and anxiety raise the likelihood of the condition. LBP may result from any one of 4 types of root causes. Injuries, tendon, ligament, and muscle strains and sprains are frequent culprits. A herniated disc or fracture can result from trauma in sports that involve contact, car accidents, or falls. Degenerative diseases. Symptoms may be exacerbated by various forms of arthritis and intervertebral disc degeneration. Disruption of the spinal cord and nerves. Lumbar stenosis develops when the bony spinal canal gradually becomes smaller. The ensuing impingement on the spinal cord and nerves causes pain. An uncommon medical emergency is known as cauda equina syndrome. It occurs when the nerves at the base of the spinal cord are compressed by an abruptly ruptured disc, causing pain, paralysis, and incontinence. Other LBP can be brought on by spinal infections and malignancies. Kidney stones and other non-spinal illnesses can mimic lower back pain. The goal of the diagnosis is to pinpoint the site of the discomfort and rule out any non-musculoskeletal conditions that might be the cause of the symptoms. A thorough medical history, physical examination, blood tests, and, if necessary, diagnostic imaging exams are all included in the evaluation. Even after a thorough workup, the actual cause of LBP sometimes remains a mystery. Although lower back pain has affected people since the beginning of time, it is increasingly common in post-industrial society. An anthropology study published in March 2022 by New York University analyzed the spines of ancient Neanderthals and contemporary humans. The lower vertebral bodies of modern humans feature wedging that was absent in the spines of Neanderthals. According to the paper, these anatomical alterations contributed to the rise of LBP in contemporary times and were caused by decreased physical activity, poor posture, and usage of furniture that accompanied industrialization. The illness is first mentioned in a papyrus from ancient Egypt that dates back 3,500 years. In the past, the Greeks had a later perspective that saw simple backaches in the context of underlying ailments. It was known as the witch's shot in the Middle Ages because people thought that external powers were to blame for the pain. According to one account, sciatica sufferers of the time had their lower extremities smoked in a fire of ferns as a form of treatment. Depending on the LBP's etiology and whether it is acute or chronic, modern therapy is individualized. Without sciatica, most abrupt attacks are brief and self-limiting. A sensible treatment plan including non-narcotic drugs, muscle relaxants, topical pain relievers, physical therapy, and continued activity can provide relief. Surgery is typically not advised for severe discomfort. Chronic LBP management is more difficult. It heavily depends on the kind of symptoms, how long they last, and what caused the discomfort. Today, a variety of efficient medical and surgical alternatives, including minimally invasive procedures, are accessible. Coordination of treatment between doctors, other providers, and patients is important to provide the greatest long-term result for the person with a chronic illness. Untreated lower back discomfort can be harmful to one's physical and mental health, but, thankfully, modern medicine provides treatments to usually cure the condition.